Hi, I'm Dr. Marc Braman. Changes to prostate cancer screening recommendations in recent years, including PSA testing, have left many confused. We're going to clear up much of that confusion today so you can make informed decisions about your health. We're also going to tell you about evidence-based options for dealing with most prostate cancer that isn't getting to the men who need to know. So why was checking for prostate cancer a good idea before, but now it isn't? Let's look at the facts. The leading organization or national committee that is tasked with looking at the science and making recommendations is the U.S. Preventive Services Task Force. The big pink bar with a big red D jumps out from the sea of blue on their website. The D here means pretty much what it did in school. It doesn't pass the test. The U.S. Preventive Services Task Force, quote, recommends against prostate-specific antigen, PSA, based screening for prostate cancer. Now, prostate cancer is the most common non-skin cancer in men in the U.S. 16% of men will be diagnosed with it at some point in their lives. But less than 3% of men will die from prostate cancer. Most men do fine without treatment and end up dying from something else. So why do we try to find cancer before we know we have it? Well, to get rid of it before it becomes unmanageable, so we can save lives. So the real question is, does prostate cancer screening save lives? And at what physical cost to the men we are trying to save? To cut to the chase, the studies show that what we have been doing doesn't make any difference. So let's do the math here. Screening costs are time, money, and risk of the current biopsy method, plus treatment costs, which are time, money, many serious negative effects, plus how many lives saved? 0. So what's the net effect? Really expensive, bad side effects. Now there's several important points. Number one, this is for the average man. It still needs to be individualized. Though even in high-risk groups like blacks and those with a family history, the evidence of net benefit is still missing. Number two, better tests that are more accurate and useful for prostate cancer are in the pipeline and may make a meaningful difference. Or they may not. And better treatments are constantly being worked on. Number three, and most important, evidence-based, meaning scientifically sound, treatment options you are likely not being told about are very important. Note the footnote. Treatment was estimated as 60% had surgical treatment, 30% got radiation, 10% got observation. Now these are appropriate estimates for the standard treatment approach. But they didn't even consider what I would want to know if I had prostate cancer. The evidence for a treatment option that was very effective and whose side effects, or physical costs, were better heart health, longer life, better erectile function, etc., and none of the nasty side effects of traditional therapy. In men with early, low-grade prostate cancer, and that's very important, a comprehensive lifestyle change program led to significantly better outcomes. Like what? In the lifestyle group, PSA went down 4%, versus the standard group went up 6%. Their disease was progressing. None of the lifestyle group needed conventional treatment with surgery, radiation, hormones, etc., versus 6 in the non-treatment group who did require these treatments due to an increase in PSA. Interesting, the lifestyle group, their blood, when they put it in the lab and tested it against cancer, it had 8 times more cancer-fighting activity than the control groups. The comprehensive lifestyle program turned on a plethora of anti-cancer genes and turned off cancer-causing genes. The program even showed that the DNA went back to a younger state. So let's do the math on this opportunity. Screening costs, time, money, risk of current biopsy method, that's the same. What are the lifestyle treatment costs? There's some time, there's money, and many significant positive effects. Does it save lives? Yes, at least the evidence so far would clearly point in that direction. Large studies are still needed. Net effect, outcome, probably quite a few lives saved, and those lives are more enjoyable and worth living, especially in the retirement years. Such a powerful and positive treatment option for early prostate cancer fundamentally changes the equation for calculating benefits and risks from prostate cancer screening and should be factored into the discussion and decision-making process.